All right, good afternoon, everyone. We're hopping back in and we have a great last panel for our spring educational conference here with NCPHA. So thank you all for being with us and thank you to all of our speakers for taking the time to present. So our last presentation is on hospital and community collaborations through the pandemic and beyond. And we are fortunate to have four wonderful speakers. I'll go ahead and introduce each of them briefly and then I'll hop off so they can share their screen. So first up is Emily Roland. Emily is the North Carolina Healthcare Association State Director of Programs within the association's foundation. In this role, Emily oversees various rural-focused and grant-funded projects, including technical assistance support for the state's coordinated network of care for the uninsured, as well as the Healthy People, Healthy Carolinas coalitions addressing chronic disease through the implementation of evidence-based interventions and policy change. Next up, we have Honey Estrada. Honey Estrada serves as the public health strategist for the Catawba County Public Health, where she directs all aspects of strategic planning, community health, communications, and quality improvement. Honey is on a mission to make Catawba a healthier place to live, learn, work, shop, play, and pray. She works with a number of community partners to identify needs, develop initiatives, and action plans to improve community health. Next up is Milton Butterworth, who is a well-respected leader in community health and has been active in building healthier, thriving, resilient communities for over 20 years. A specialist in the areas of community health, farm worker outreach, and multi-sector collaborations, he has led multiple teams to successfully develop and implement community strategies to increase culturally competent healthcare access for vulnerable populations, including migrant and seasonal agricultural workers, those experience homelessness, and other diverse communities. Finally, we have Jamila Pinder. Jamila has been a dedicated employee of Cone Health for over 20 years and has an extensive background working with the uninsured and underinsured residents of both Guilford and Rockingham counties. A graduate of NC State University's BS in Agricultural and Environmental Systems, Jamila utilizes her education and experience to help develop and support local coalitions. So thank you all for being with us. I'm gonna duck off backstage here so you can bring up the presentation. I look forward to learning from you all.
Thank you so much, Michael, and bear with me as I share my screen. Is everybody able to see that? Hopefully that turned out okay. Well, thank you so much. I know one of the challenges, of course, of being in the virtual environment is dealing with technical difficulties, but at the same time, one of the beauties of being in the virtual environment is that I am just thrilled to have so many partners here telling the story about hospital and community collaboration that I absolutely could not do on my own. So just excited to have these partners here today. So thank you so much for that introduction, Michael. Thank you to the speakers from earlier today. What a rich day of discussion and learning around storytelling, around equity, around messaging, just really powerful, and really appreciate being a part of today's learning session. And have participated in other NCPHA events. All of the rich discussion. So I wanted to start today by really with a thank you. It is not lost to me the importance and really the honor it is to speak to the public health leaders in the state amidst one of the biggest public health crises of our lifetimes. So the fact that I'm even able to be here on behalf of the Healthcare Association, I'm just, again, just honored and thankful for your work. Your perseverance, your strength, your selflessness, your skill and expertise, your empathy, your commitment to supporting, protecting, treating, and listening to bring us through this challenging time has just been incredible. And the fact that North Carolina has been recognized as a leader and model in our response to the pandemic and our commitment to collecting and sharing data inclusive of race and ethnicity and creating and implementing systems to prioritize equity and pandemic response and recovery has been incredible. And your involvement and leadership in those efforts and your understanding of those issues, even before so many of us, I'm just very thankful to be in front of this group today. And of course, what we continue to learn is we cannot do any of this work alone. And I say that for hospitals and for public health. Health is a continuum, as we know, that both begins where we live, learn, work, and play, and also requires the systems in place to ensure we can access healthcare when and how we need it. We need each other to keep communities healthy and to truly achieve population health, and working in silos only slows our progress towards true health improvement and achieving health equity. So in my presentation today, alongside with my partners, I seek to share stories from hospitals and partners across North Carolina that in the face of crisis identified an opportunity for relationship, a theme that's come up a lot of times today. Leveraging the strength of each partner, these groups came together around a shared purpose that could never have been achieved alone, and identifying ways to learn from their experiences and sustaining their efforts beyond critical, informing how we all do work differently and moving forward together. So in this slide, I'm just revisiting the objectives of today, and just wanted to take a moment to talk about the foundation itself and what that is, since my role lives within the NCHA Foundation. So I'm currently the state director for programs for the North Carolina Healthcare Foundation, and the foundation is the 501c3 affiliate of the North Carolina Healthcare Association, which is a trade association representing hospitals, health systems, and other healthcare stakeholders across North Carolina. As the nonprofit arm of the association, the North Carolina Healthcare Foundation is proud to work with a number of partnering organizations and funders across the state, including the North Carolina Division of Public Health, the Duke Endowment, Kate B. Reynolds Charitable Trust, the North Carolina Office of Rural Health, and the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services to support key initiatives around hospital and community partnerships, determinants of health, quality improvement in rural hospitals, and addressing various barriers to individuals accessing high quality healthcare across the state. So that's a little bit about our foundation. So next, I want to just take a look back. So this is in 2014, I joined the North Carolina Healthcare Association in our advocacy and policy department. So my original role was coordinating and directing hospital member advocacy efforts. The need had been identified across our members and our NCHA leadership team that advocacy efforts needed to be deepened and strengthened. However, the key to the success was not having the most powerful lobbying teams or the executive suite of the largest health systems to come down to Raleigh, but it was really in having the most engaged grassroots advocates telling the hospital story on behalf of their communities, as well as inviting lawmakers to join them in their communities. And this doesn't just happen overnight. Our work first ultimately feel the impact of their hospital in their own lives and their own work, and intersecting with their own priorities in order to share that story. So our work really began and continues. So step one, when I came into that role, was talking about engaging your communities. And I spoke with hospitals cases, but it was really elevating this to the advocacy platform, that if you wanted lawmakers to understand the value of your hospital, you needed to ensure your community understands and feels that message. And when you engage stakeholders across provider groups and across sectors, you can truly illustrate the pervasive impact of health across all systems. And you really needed your community to tell that story. And also your community represents constituents and other stakeholders outside of your hospital, and is likely the trusted source that legislators look to. So this picture here is illustrates Advocacy Day, the first Advocacy Day I coordinated in 2015 at the and instead of, again, just having our hospital leaders come down to talk with their lawmakers, we asked them to reach out to their community connectors within their health system that were prioritizing work outside of their hospital walls to come and speak to their lawmakers about the work that they were doing. And this was different than Advocacy Days prior, and really it's remained a critical component of Advocacy Days since. So the idea that just communities are really key. Fast forward to 2019, my role transitioned from our advocacy department to our foundation team. My work continues to be anchored in the intersection of hospitals and their partnerships with communities, but now with an aim on community health improvement. Success is not measured in only how you're engaging your community and telling your story, but also in understanding and elevating the collaborations that are driving health outcomes and reducing health disparities for a healthier North Carolina for everyone. But I thought it was interesting as I was putting this presentation together that this from a grassroots 101 slide deck from my grassroots advocacy days. And I felt like many of the messages still remain and rang true for this work as well. So in a weird way, you can connect, communities in a way to how you can influence lawmakers as well. But it was really all about building authentic relationships, being a trusted resource or finding a trusted resource and engaging them, communicating regularly, not just in a time of crisis, and keeping that communication ongoing, inviting them in, but also showing up and meeting them where they are, and then telling your story, being transparent, vulnerable, and authentic. So again, in this way, communities were like legislators, but really focusing time and attention here on these relationships is even more influential. So I felt like that translated to today's presentation, and just the idea that the communities are that common thread. So in 2018, NCHA reestablished our foundation. It had been around since the beginning of the association, but we sort of unearthed it to make a fundamental expansion of scope from hospital-based quality improvement to it being a vehicle for driving hospital community collaborations, systems change, and equity. Led by our member hospitals and our board, community partnerships and collaboration were actually called out explicitly in our mission statements, making it evident that healthy communities, partnerships, and collaboration are critical to our work. And the health needs of our communities extend far beyond, of course, our health system walls. So 2 specific programs in our foundation I wanted to highlight today, because our partners are involved in these that I'm sharing with you shortly, but our Access Health and Healthy People, Healthy Carolinas. Access Health, and both of these initiatives are funded by the Duke Endowment. The foundation is involved in providing technical assistance and data and evaluation support to these programs. And far before NCHA was involved in this technical assistance initiative. But they're allowing us to learn about the models of incredible and positive and productive community and hospital collaboration. So Access Health is about networks of care that connect uninsured individuals in North Carolina with the care they need in a timely way. And then Healthy People, Healthy Carolinas involves multi-sector coalitions, including hospitals and health departments, schools and faith leaders, and a variety of other community stakeholders to drive community health improvement. So again, these are models that we want to continue to elevate and emulate in our work. So similar to the lessons I've learned in my work with advocacy and the rest of my tenure at NCHA, it's hearing the stories and experiences of the work of our members and our partners that really reflects the authentic message. And with that in mind, I invited a few of those partners to co-present with me today and share their experiences of hospital and community collaborations and how these partnerships have strengthened their work and will be forward. So next I know Michael provided an introduction to each of our speakers, but next I'd like to introduce Jamila Pender with Cone Health. Jamila?
Yeah, good afternoon. My name is Jamila Pender. I'm with Cone Health, and I work in the Healthy Communities Department. And my affiliation with Emily, like you said, is one of my areas of responsibility is with our Access Care Network up in Rockingham County. And so I oversee that as part of our health system collaboration is working with linking up uninsured residents to primary care and other social resource needs in Rockingham County. And when we talk about pre-pandemic, what does that look like as a result of the work that we are doing? As a result of the work that we were doing pre the pandemic, that kind of set the stage for where that path forward looked like. And so some of the things that we did as working with our Access Health Network and as work in collaborating with the health system and other partners in the community, we were really intentional about asking, not necessarily us coming and saying we can do this, but what does it really look like to be able to meet the immediate needs that you had. And several of the needs that they had was their transportation challenges. And so being able to work with, I'm fortunate because I work in 3 different counties and work with 3 different health departments and community partners, was being able to say, this is what I have, this is what you need. In many cases, now I'm working with health systems, it's a lot of we build it and we want people to come, or again, as we started to go into trying to meet the needs of those we're serving, how, not necessarily how do we reach individuals or how do we reach people, but what it really truly look like is how are we creating the conditions for people to be able to reach us when they need us. And so one of the things we worked with some of our community partners around food, because we know that food was one of the biggest challenges that many people in the communities were experiencing. So being able to collaborate and partner with our food partners within our organization, we were able to say, hey, we have the food, you need transportation to get the food out to the communities that we know that had some transportation barriers. And then we added to that was saying, okay, let's look at some of the needs that came up was testing. So how we could be able to provide transportation to distribute food, but then also looking at you can go to the next slide. We had a mobile van. So using our mobile van to be able to say, hey, we can go ahead and provide, bring the testing out to the site. So being able to, we know going to the sites where we were providing food, working with our community partners and community members, and then saying, okay, we hear the need that people wanted testing. So then to be able to say, okay, we can bring testing to some of the areas where we knew that there were barriers with people being able to go to testing sites. Then to turn that to lead into, once we got to being able to do vaccine distribution, to be able to go back and to work with those partners and say, so what are some of the things that we can do to be able to assist you? So not necessarily us doing it, but working collectively and collaboratively with some of our partners. And what you see here is just really looking at from a health system standpoint, because again, we were used to being able to, when people come to us, but having to shift in how we take that approach and saying, okay, who are those trusted community leaders? Who are those trusted partners? We know that they have the resources, bringing some of the resources that we have together, and some of that came with our data sharing. So being able to really use our data to help us make better data informed decisions on which way we needed to go, and then how we can come together with resources. What you see here, because I feel like a picture just speaks volumes, is here's an example of where we did that. So we had access to some of the vaccines. We needed more clinical staff. And so we partnered with our health department, with the clinical staff, and then we were able to use our automated system with going on site and doing our mobile, with automating and how we were doing data collection on site. And so then here is an example of where we were able to partner not only with the county, but also with the city and working with other community partners to be able to provide COVID testing, as you see in this picture right here. So again, looking at how can we leverage our strengths and put all of those together so that we can be able to enhance the health of the communities that we're serving. If you go to the next slide. One of the things we also were able to do is looking at different ways in terms of our collaboration. So as you see here, again, we had our mobile vans. So we had 2 mobile vans where we were able to go out and provide COVID testing, as well as providing vaccines in some of our remote areas. And so again, saying we have this resource, you have this resource, how can we better leverage that? And then really debriefing after we've had that to say, how can we enhance this? What are some of the things that we can do differently? Working with our faith-based partners to be able to do this. So again, this is very different because typically when you're looking at the healthcare system and working with the hospitals, it's more or less, how do we get them to come to us, and really shifting in how we approach this, approach different opportunities to say, okay, what can we be doing differently? How can we leverage our relationships? And sometimes also kind of like flying a plane, when you look at a pilot and a co-pilot, and being able to recognize at what point we need to be the pilot and when we need to be the co-pilot. Again, several opportunities where, again, from a health equity lens, looking at how we partner to be able to reach some of our reaching our Latinx and our Asian American communities, and again, showing up. And so that was one of the things we continually got feedback from was, wow, we've never seen you here before. Oh, wow, thank you so much. And it's just so rewarding when we were able to walk away, or just when people were just saying, well, thank you so much. I just thank you for coming here, or thank you so much. You didn't have to do that. And that, continuing to acknowledge that and represent, say you matter, and it matters for us to show up here and just show us how we can continue to show up and enhance the relationships. And so here you can see at the in the middle picture where we huddled. And so one of the things is, finding the joy in huddling and communicating with each other. And so again, not necessarily how can we reach people, but how can people reach us, and going and saying, what are your immediate needs right now? How can we address those immediate needs, and look for other ways to make it simple for others to be able to really get the needs met that they need. And again, I have on here the act of nurturing. And so it's not a one and done, because we had already started building these partnerships and working together to be able to address health and well-being in the community. It was a natural attrition for us to be able to go in when the pandemic happened, because of relationships we were building, to say, hey, well, you're over here on this side, you're over here. What can we do? How can we combine our resources to be able to really truly meet the need? And then just moving forward, how we continue to nurture that relationship, because it's not one and done. And so when we looked at being able to address some of the social needs, such as food and housing and testing and vaccines, again, as a result of us doing this, identifying how so many people didn't have access to a care, because majority of the communication was go seek your healthcare provider, go talk to your provider. But what if you don't have access to a provider? Or what if you have some linguistic barriers? And so really sitting down and collaboratively working together to see how we can truly meet this need collectively, and how we can continue to build and nurture on these relationships, these new relationships that we built, and then again, continue to foster the relationships that we have. So grateful for this opportunity, and how, again, really looking at it from not necessarily a transactional, but a relational, and what are things that we need to do to really be able to cultivate those relationships that we have. And then just truly be vulnerable and understanding that we don't have all the answers, and we don't have all the resources, and going into it knowing that, and what place do we need to be in, and developing those areas, and being willing, and being, like Emily presented before, those authentic relationships, what that authenticity does and allows us to do, to really be able to create that path forward, and through that vulnerability to really say, wow, look at what we've been able to do together. So I would just leave you with, again, just continuing to encourage and nourish the relationships we have, because again, this is something, like they say, it's not a sprint, it's a marathon. And so as we continue to work together, we'll continue to find other ways in how we can enhance and enrich the partnerships that we have. Thank you.
Much, Jamila. Really appreciated those examples. And next, Honey Estrada with Catawba County Public Health.
Thank you, Emily. What's going on, y'all? Happy Tuesday to everybody. It's really pretty and sunny out here where I'm at, and I really hope that it's pretty and sunny where you're at too. So it's good to see you all. It's good to be here with you guys. I am Honey Estrada, the public health strategist for Catawba County Public Health. And, I think that one of the things that we do really well here in Catawba County is partnerships. And so in this, as we're talking about partnerships between the health systems and where I'm at, which is a local health department, we are very fortunate in our county to have two health systems. So we have Catawba Valley Health System and Fry Regional Medical Center, and they are both really tremendous partners for us here at Public Health. So big shout out to them. But among them, there are so many other partners that come to the table that I want to lift up. And so if we can go to the next slide, please, Emily. And so, Live Well Catawba is to give you guys a little bit of context. Live Well Catawba is a 501c3 inside of public health, and we are funded through the Duke Endowment, through Healthy People, Healthy Carolinas. So, shout out to HPHC, and they are tremendous partners and provide mad support for us. So, very thankful for them. But as we consider what Live Well looks like for us, this is the community coalition for Catawba County. And this really, for me, the way I like to explain it, it's kind of the vehicle that we get the work done through. And so it is a community coalition. It is open to all community partners and all community members here in this community. And, we really invite everyone to the table to be a part of this, because we understand the importance of relationships and having those voices be here, especially as we consider work that is equitable in practice. And so, I think about, our community health assessment and our community health improvement plan, all of that work that is done. We, this past cycle, our 2019 community health assessment, we had about 40 different community partners at the table helping us work through that, and then what we ended up doing is taking our health priorities and breaking that out into 3 different work groups. And those work groups consist of, again, lots of different partners and lots of community members to make sure that we really have those experts at the table here at Public Health. I know that this is a reoccurring theme. We do not have all the answers at Public Health, but having those experts at the table to guide our work and to provide feedback and insight as to what we think as a community is going to work best and how can we continue to move this work forward has been, having their voices at the table has been absolutely vital for us. And so I, at the next slide, I want to just showcase a little bit of what this season has looked like for us. So this is our virtual coalition meeting. Check out those lovely people. And so really wanting to just lift these folks up, because these right here are the true MVPs. These are the people that are doing the work on the ground day in and day out. They have continued to be engaged. And I'm so proud of these folks, because we really had no clue what was going to happen, as many of you all do. It was just a very ambiguous time, and I think that this really speaks volumes to the partnerships that we have here in this community. Not only did we maintain our engagement, but it also increased. It increased. And, at our last coalition meeting, we had record attendance. And so I really think that it just speaks to how dedicated these folks are to really achieving community health and really improving what we're doing here in Catawba County. And, we try really hard to make sure that we have diversity and inclusivity, making sure that we're going out to those target areas that we're really trying to focus on and ensure that the end user, those people, the people who live there in those communities, that their voices are represented at the table, not just the health systems, not just public health, not just our partner agencies, but the people who are there that's going to be receiving, whatever initiatives that we're going to roll out. It's so important to make sure that their voices are at the table. And so I see a couple of them here in this picture, but just so incredibly thankful for these folks and their partnership and their commitment to really community health. Next slide, please, Emily. And so what I will wrap up with is that, and I say this all the time, that is that it really does take a village. It is not a one organization, one agency, one person show. It really takes all of us working together to really achieve community health. And so I'm just so incredibly thankful for our partners, and much like you, the partners in your area, that are continuing to do this work day in and day out. So shout out to all of you all who are true MVPs in your local communities, continuing to move the needle forward in all things. So thank y'all.
So much, honey. Really appreciated those incredible stories from Catawba County. And next, I'd like to introduce Milton Butterworth. Milton?
Thanks, Emily. It's great to be here and share this time with our public health colleagues. Emily, a quick housekeeping. Remind me, are we hoping to have time for Q&A and/or do you have slides that you are going to cover after I go?
There's a couple of tiny points I'll weave in at the end after you, Milton, and then we'll go into Q&A. But y'all's stories are the most valuable. Take the time you need. I'll squeeze in my piece.
All right, great. That sounds good. All right. Well, I wanted to start quickly with sort of my role and my community. Next slide, Emily. Henderson County, North Carolina, is between Asheville and Greenville, South Carolina. And that's a unique place in the foothills of the mountains. I am the hospital's community health manager here at Pardee UNC Healthcare. But my first charge in the first few years of my role here is to manage the Healthy People, Healthy Carolinas grant. So I'm the Healthy People, Healthy Carolinas coordinator that you've heard discussed here today. This pandemic has brought a unique opportunity to bring those two foci together. So where my role as community health manager is a long-term role beyond the grant, I work with Healthy People, Healthy Carolinas, and particularly their more recent focus on equity and health disparities is a great crossroads and intersection under the pandemic. As we all know, crisis brings opportunity. And there certainly have been opportunities to address everything from equity to access to healthcare in general. All right, next slide. I've tried to break this my time with you all up into a couple of different pieces: community collaboration, messaging, marketing, and media, equitable access to vaccine, and then spend some time on successes and challenges. And as I'm sure none of you are surprised, that's a tall order with any kind of a time limit. So I'm going to race through this information pretty quickly in the hopes that we have some time for question and answers. Community collaboration. I think I would be remiss not to start with my experience here in the hospital. First and foremost, the healthcare staff across all the disciplines in the hospital and across our community have exhibited an extraordinary level of collaboration, an extraordinary level of sacrifice, and without that, we would not have had the success that we have had from this challenging time. So a huge shout out to all of my colleagues in hospitals and health departments and other healthcare facilities in North Carolina. So when we think about that, that's broken into a couple of different things that I think are relevant to understanding the challenges to partnering. Different healthcare entities are charged with different aspects, and rightfully so, of not only pandemic work, but across healthcare in general. And what I mean by that is, I think we can loosely think about hospitals as being involved in treatment. And so traditionally, hospitals are thinking more about people coming to them. And when we think about public health and perhaps other types of health entities, it's a charge of working with the public and managing health across a population or the public. And so the vaccine fits really firmly or nicely into that effort. And so trying to create synchronicity, if you will, between those massive two-pronged efforts is very challenging. And I don't think any of us were ready for the staffing challenges that would present. So in order to get some additional perspective on this unique time that we've been through and how it relates to community collaboration, I had the opportunity to interview a variety of different hospital staff. And so most of the things that I talk about today, other than the fact that my role is very much out in the community, comes with some I hope very helpful anecdotes and tidbits that are related to the hospital experience in particular. And the first thing I want to talk about there is this sense that knowledge is power. And that was something that our chief medical officer, Dr. Ellis, exclaimed in my time with him. And that might sound a bit trite, but he really was tacking that on to the end of an explanation of how remarkable the collaboration has been in our community and in our region of Western North Carolina, more than he has seen in his career here. What does he mean? Well, he was talking about how from the very beginning, there was high-level daily communication among health and emergency leaders, which included the chief medical officers of hospitals, health directors, the local FQHC or community health center, providers serving nursing homes, as well as incredibly strong contributions from our emergency management director. And so myself, having had the opportunity to interact with some of those individuals in a real on-the-ground sort of a way, I also was struck by how remarkable that collaboration is. Well, what does he mean by knowledge is power? The purpose of those meetings that he experienced were really all around trying to share information in a real-time way that helped mitigate this enormous challenge that we've all faced about rapidly changing information, misinformation, and our entire society trying to learn and get their heads around this challenge that we've been facing. So knowledge is power was something that really struck him as sort of seminal with respect to community collaboration. Then I want to emphasize that occurred at a high level, and there was a regional example of this as well with the Western North Carolina Health Network, a number of the health directors in the region, as well as hospital CMOs, and even a large regional funder that got together initially daily and then weekly, and then only just recently is sunsetting that practice in the hopes that we are getting to a less critical time. The next piece I want to emphasize with respect to community collaboration is really around trust. And I think we all have heard that word, and it's really important. One aspect of trust is how important it is to trust the skills and assets of our community partners, to not try to do it all. And if you're like me, you want to try to take it all on and make it all happen. But we have community partners, we have entities in the community that are in a position to be able to utilize their expertise. So that's one of the huge lessons that is learned in a crisis environment like this, is how important it is to turn things over. You can't. No one organization can accomplish what is needed in times of crisis, and frankly, with the heavy lift that community health improvement represents in general. A couple of anecdotes to share with you guys, starting with employers. One of the people I interviewed was somebody that works with Party at Work, and they are involved with direct marketing and business development with employers. One of the things that she found that was really helpful and interesting, helpful and valuable, but was already established, was she had already been in her ongoing collaborations with business and industry. She'd been collecting their questions and providing answers, listening to business community's frustrations. And so that sets the stage really nicely for some of the conversations that employers desperately needed to have once the pandemic hit full swing. So that ability to already have that environment or that space developed was critical to some of the success that she found in terms of bringing those folks together. So in summary, once she was able to kind of adapt the regular sort of phone calls that she would have with some of her employer clients, those were roughly every 2 weeks, and were with an individual employer. About 3 to 6 months ago, she started to bring employers together in one environment on a virtual call, and sort of opened that opportunity up to employers as a group, thereby creating a bit of a focus group environment where they could learn from each other, they could hear from each other in terms of common challenges, and they were able to benefit from the trust that was built by the Pardee at Work representative from the standpoint of that one source of information, hopefully that helped cut through some of the challenges. I think we can learn from that, everything that has happened in the pandemic environment, and whether or not we had it in place beforehand or whether we adapted it during the crisis is something that we all need to double down on in our work moving forward, not only to mitigate and be ready for future pandemics, but in many ways it is the secret sauce that gets us where we need to go when it comes to community health improvement. So I touched on this a little bit already. Hospitals and other healthcare providers are used to the treatment piece. Public health is thinking about the whole community's health and how to communicate that and how to affect positive behavior change across a whole community. And one of the things that I picked up on in the interviews that was a positive in our community is we benefited a tremendous amount from the integration of those approaches. So it's really important that there's respect for those different areas and how they approach challenges like a pandemic or even just community health improvement in general. And so it really shone a spotlight on the importance of that and how there may be expertise in the clinical environment on the hospital side that can inform the messaging that public health needs to lead in terms of creating a one voice for the community to understand. So that was an important piece. And then community partners, and there's a wide variety of different kinds of community partners that contribute not only to the crisis space, but also to community health improvement. One of the big things that they bring is the established trust and relationships that they have with the populations that they serve. And so that's part of what I mean by we have an opportunity to share the load by depending on and taking advantage of the assets and resources like trust and relationship building that our community partners have already exhibited. All right, let's see, where am I in this conversation? I think I have jumped down a little bit here. One more thing I wanted to mention but before we get into messaging, marketing, and media is, like Live Well Catawba, we have a strong coalition, the Henderson County Partnership for Health. So we did have the advantage of, we already had a meeting, a convening, if you will, around issues and challenges facing us in the community health improvement space. And so we had already built a lot of the social capital to be that sort of coalition or that one of those meetings in the community that you want to be at and that you want to attend. And so having those relationships and that platform and strengthening it through the Healthy People, Healthy Carolinas experience that we've had really put us in a nice position to be able to do some of those things and be ready to do them. I'll talk a little bit more about that here as we get into messaging, marketing, and media. All right, so the next slide is about that. And the first question is how. So Emily, if you don't mind to move us to the next slide, we'll get into that piece. There's a variety of different ways that we've accomplished this messaging, marketing, and media. And it starts with the high-level health leaders that piece of the conversation that's so important. Emily, if you don't mind, it's actually the slide right before this one. And maybe we may have slowed down a little bit in terms of the present. There we go. Perfect. All right. And then one real great example of sort of at the provider level of an intervention that really worked nicely. It was hosted by our health department. who's similar to Live Well Catawba, also provides a lot of the backbone, if you will, for our Partnership for Health. They immediately, along with the Partnership for Health, launched a COVID-19 response community services call. And this email list was, not surprisingly, some 80 organizations and individuals in the community. And we often had 50 to 60 people on the call. Those calls were weekly, and they were really designed for organizations, community partners that were involved in community services. So not necessarily and mostly not clinical in nature, but that they felt that they were stakeholders in health improvement, and particularly from the standpoint of the social determinants of health. So we talked a lot about childcare, we talked a lot about food insecurity, and a lot of our best interventions were launched out of that space. So just a traditional old roundtable where we get together and focus on 3 or 4 critical aspects of the challenge in front of us really did yield dividends. And again, that camaraderie that had already been established in our community, that expectation that that people work together is really important to that. I'm going to try to speed through the rest of these things so that I can get to successes and challenges. There's never enough time to have these conversations, but I do want to touch on a couple of other things in messaging and marketing and media. Word of mouth is incredibly important, I think, as we all know. Public relations, marketing, and the press are important, but we really learned that we had to adapt what we would normally do, or what a hospital would normally do, and that's not surprising. So we worked on a PR strategy that allowed the messaging to really become a trusted source of information. We utilized one face, one voice as much as possible to make that identifiable to the community in terms of promoting feelings like, I recognize this person and I need to pay attention. The media could depend on regular briefings. They didn't have to ask. So we did a lot of that, try to be really proactive about those things. A lot of the communication was necessary with our own team members. So that presented an enormous challenge for your typical marketing effort. We needed to be engaging and providing accurate information to our own team members in the hospital, as well as the community. And then we certainly did some more traditional things, like setting up a web page that had downloadables that could be updated in as real time as possible, getting at that challenge that we all experienced around changing information. And then there were those that were that one of the things that worked the best was we adapted some of those downloadables to emails that could be sent out through established networks. Those particularly with our community-facing staff, myself, the community relations officer, folks at Party at Work, and did so in a way that personalized the information. And what was nice about that was having that sort of finger on the pulse, and that connectivity in the community allowed us to really learn using feedback from questions that we would get in the community. So kudos to our marketing and communications team for being responsive to those community-facing staff as they learned and heard and answered questions from the community itself. So adapting that feedback was powerful and really reminded us of many parallels that we can draw from this experience to the need for non-traditional ways to attack general disparities and barriers to healthcare. One size does not fit all. That is not the best approach to any of this work that we face in community health improvement, and that's true in a pandemic environment as well. Spending time getting to know your community and your community partners when you are not in a pandemic environment is super critical. And that's going to take us to the next slide, Emily, under equitable access to vaccine. Again, I want to reinforce that our community partners are an asset and a resource, and we should not try to do it all. In fact, one of the things that we really learned in the face of enormous needs for education and lots of concern still to this day around hesitancy with the vaccine, we decided to start with those who know they want the vaccine and go from there. And so we reached out to everything from African American churches to the Latino Advocacy Coalition that works on integrating new immigrants in the community, and presented an opportunity that was really based on what can we do? What do we know about our community? And what are the barriers that people have to the existing ways that we have learned to deliver this vaccine? And so in our community, one of the biggest ways that we did it, the largest operation and perhaps the most efficient was through a partnership with the community college, as well as a huge host of volunteers from a wealthy community that allowed us to stand up a centralized vaccine operation in a large conference hall. And so that in and of itself was a very efficient operation and allowed us to do thousands of vaccines a week in the heyday of that effort. But we recognize that there are challenges to getting an appointment. So what we did was we really focused on breaking down barriers to scheduling vaccine appointments. And we learned a tremendous amount from our community partners around what those challenges were and how our own operational traditions and how we operate as healthcare providers builds inherent barriers and challenges to people who are seeking access to healthcare. And so what we and several of our community facing staff did, we developed an interest form that we spread into the community through community leaders and our community partners that offered the individual an opportunity to express their desire to get a vaccine. And that really enabled us to get all of the members of Star Bethel Church, for example, down the street from the hospital that were interested in a vaccine vaccinated. And we were able to get them appointments in that current structure. So we learned a lot about the challenges that exist in terms of traditional access to healthcare and the work we still have in front of us to create an equitable environment for all of our community members when they have health needs. So I recognize we're getting short on time and haven't even gotten to successes and challenges. I want to share one big picture success that really that's hard not to spotlight, and that is that early on in that high level work that we engaged with healthcare leaders, we were able to utilize that shared knowledge to work quickly with nursing homes to address the challenges that they were facing right there in their facilities. This was really valuable in order for us to get time to get our feet under us and kept those people out of the hospital and treated them where they already were easy to be treated within those environments. So that was an enormous thing that we learned from sharing that knowledge together at a high level. There are a lot of other great examples. One challenge that I want to leave you all with, and before we get into some question and answer, is, this information was a rapidly moving target, and it's hard to keep that from eroding community trust. And we were constantly feeling like we were asking for people to change their usual behavior based on information that changed all the time. It was challenging to even create a flyer that represented to the average person how they could access the vaccine or how they could get the information that they needed to make a good decision. And so building those relationships through community leaders and community partners allowed for some word of mouth traveling that really in a lot of ways shines again an important spotlight on the work that we have ahead of us. I hope for all of you that you are able in your communities to spend time thinking through what the challenges were, what the lessons were that you learned, and figure out how to apply that as we move forward with the already heavy challenge of how do we authentically engage our communities, how do we build cultures of health in our communities, and how do we get past the most traditional ways that we're used to attacking those problems.
Thank you so much, Roland. And I think there's no question about the passion that each of these partners has for the work they're doing in their communities. And just thank you so much for sharing those, really specific examples about how the health system and the community have partnered together, especially in the midst of addressing COVID. A few just final thoughts I just want to leave here. First of all, just recognizing that COVID really did serve as this catalyst for any, in many Jamila and Milton spoke about today, they already have these great foundations of trust and relationship that they could build on. It can really serve as this catalyst to move those relationships forward. Next, number of and all my partners really highlighted that hospital community collaborations were critical amidst COVID response for leveraging expertise from every partner in the health system and the public health sphere and partners in the community, partnering together to increase access and remove barriers. The message and reaching out and building trust was tremendous, and ensuring equity. And it really, health systems were depending on community partners in so many cases to do that work. And to partner with them in doing that work, I should say. And the last thing I want to leave here is just around elevating and sustaining, and the North Carolina Healthcare Foundation's interest in continuing to learn from and lift up the importance of partnership with our members. So the NCHF mission and vision remains the same as it has been since we reestablished ourselves a few years ago, to foster and accelerate the collective impact of hospitals, health systems, and community partners to improve the health of North Carolina. But we're really approaching it differently, and how we're engaging the community is differently. And I'm most excited to recognize that we've established with a partnership with the Duke Endowment and the South Carolina Hospital Association, a Carolinas Health Innovation Institute that's really interested in engaging providers, payers, and communities to rebuild systems of health in the Carolinas, and it's thinking of that through innovation. And one of the most exciting things, I think, is that we continue to hear from our members is that collaboration is innovation. So innovation can be defined in so many ways, but the important piece here that I want to highlight for this presentation is really that our members have defined collaboration is really the innovation that we want to drive forward in so many ways. So we're continuing to identify ways to do that through our foundation, through our members, to leverage data and support that collaboration and show the impact of what community partnership can really mean for health improvement, and look forward to continuing to do that work. And then just ending with just a note about, I was reminded of this quote recently from a virtual town hall that we did with our member health system leaders from Vidant Health, from Wake Med, and from Novant Health, about coming together as the beginning, keeping together as progress, and working success. And this idea that COVID has really created an opportunity. It's allowed us to realize we can do things differently. It doesn't have to be the way we've always done it. We've reestablished partnerships. We've built on current partnerships, and there's ways for us to all come together and really drive this work forward. And so looking forward to partnering with so many of you all, continuing partnership with those on the phone today and have joined me today, and just appreciate this opportunity to talk a little bit more about these powerful partnerships to support health. So that's, I'd love to take questions. Oops, there's my children. I apologize. But let me see if I can. But I think we might be coming to the end of the hour at 3:30, right on 3:30. I apologize. That didn't leave a lot of room for Q&A. But if there's folks, people want to put some comments in the chat, I'm sure that myself and my partners would love to follow up with that at a later date as well. So thank you. Opportunity.
All right. Anybody have a quick question for the panel or comment? Thank you all again. What a wonderful way to round out the day, and so much perspective from around the state. I think that's perfect for this conference, for NCPHA, and for the last session. So thank you all for sharing your lessons learned and your expertise. I think that might round us out, but you got a network of folks to pull from if you want to reach out to them afterwards. I'm sure they'd be happy to share their thoughts and ideas with you. And certainly we all benefited from your presentation today. So thank you again. Emily, Honey, Milton, and Jamila, you all were wonderful. And there's Emily's email, so you can fill up her inbox as well. Awesome. Well, again, folks, we're at 3:30, so I'll go ahead and round us out. I want to first start by thanking all of our speakers. What a tremendous conference, made possible by all of the folks who took the time to put together presentations and share their insights with us. Dawn, Elizabeth, Jean, Mark, Quaylee, Emily, Jamila, Honey, and Milton. You all were excellent. We're so grateful. This was NCPHA has a track record, I think, of very relevant and useful and interesting conferences. And this one was right up there at the top for me. I've always enjoyed the spring conference. Obviously, switching virtual is a little different, but we navigated it. And I think, as Emily alluded to, being able to have folks from across the state participate was a real asset. So thank you all for being here. And thank you to all of our speakers. As always, Kim Dittman, thank you. She runs the show for us and she keeps us moving, and she did it again today, adapting to the circumstances. So Kim, thank you as always for keeping NCPHA running and putting together and helping us run these amazing conferences. Katie, thank you for your leadership as well for NCPHA and all of the public health associations. We appreciate you as well and kicking us off today. Of course, a huge thank you to our planning committee, led by our Vice President, Rod Jenkins, and a number of other public health leaders across the state. You all did an excellent job on this, and I'm so grateful to you all for putting this together. And thank you to our attendees who make this event worthwhile. So we had a good turnout today, and it's being recorded. So we're so grateful that you all could take the time to be with us, and all of our NCPHA members as well. And this is my chance to plug our next conference, which is going to be in person this year. So I think somebody in the last presentation mentioned the challenges with changing guidance. And certainly we felt some of that in the last week, I think, as public health professionals. But looking ahead to the fall, we're looking forward to being back together in person, which I think is a little nerve-wracking, but I think it'll be really fun for all of us and bring about some networking experiences in addition to all the learning we can do together in a conference. So please mark your calendars, October 6th through 8th in the wonderful city of Asheville in Western North Carolina. The theme, building off the spring conference theme, will be Connectedness and Equity. Public Health Creates a Healthier North Carolina. And we're the planning committee for the fall conference is also doing a wonderful job. Registration opens up on the NCPHA website on June 1st. So just a couple weeks out, you can go ahead and reserve your spot for the conference, and we look forward to seeing you all there. And again, thank you all for being part of this year's spring conference. We look forward to seeing you in the fall. And thank you, Kim, for running the show. Hope y'all have a good rest of your afternoon. Take care, everyone.